And if you start an antifungal medication in the beginning and that you do have any mold living or colonized in your system, when you start that, it'll, when it kills the mold, it'll release more mycotoxins. So you essentially just flood your system with more of the same thing that was already making you sick. And so people just get sicker. When they go in the wrong order, they go too fast, or they try to go from 0 to 100.
Hello, everyone, and welcome to your Indoor Air podcast brought to you by Change the Air Foundation. My name is Kendra Seymour, and today we're discussing treatment options for those who have been made sick by mold and water damage homes and buildings. And I'm joined today by Dr. Terri Fox, who is our newest member of our Change the Air Foundation Medical Advisory Panel. So I'm so excited she's here. Thank you so much for taking time out of your busy schedule to, share your expertise with us today.
Thank you so much for having me. And I'm a big fan of the Change the Air Foundation, so I'm happy to be
Ah,
here.
thank you. Yeah, your work that you're doing, I'm so glad we've been able to connect and the synergy there. So I think today's episode is going to be awesome for people. But before we jump in, I want to take a moment and thank our two of our corporate partners. Now, as many of you know, Change the Air Foundation is a nonprofit. So we rely on the generosity of our listeners and our followers in order to do the work that we're doing. And part of that work is made possible by our corporate partners who are just as passionate and committed to, improving people's health by improving the air in their home. And so today I want to give a big shout out to HNST Mold Inspections in New York and New Jersey and Green Home Solutions of Denver. We've gotten to know the owners of both these companies, and it's just so refreshing to see businesses who are really putting their clients' health and needs first. And so thank you to both of those companies for keeping our resources free for everyone to enjoy. And for anyone listening, you can always learn more about our corporate partners or other sponsorship opportunities at our website, changetheairfoundation.org. So check that out. Now, before Dr. Fox and I jump into it, I want to tell you a little bit more about her impressive background. She is a holistic and integrative functional medicine doctor in Boulder, Colorado, and she works on her patients' behalf as a medical detective, searching for those underlying dysfunction instead of just treating the symptoms. She has expertise in fatigue, bioidentical hormones, sleep disorders, gastrointestinal dysfunction, and chronic inflammatory response syndrome from mold toxicity and Lyme disease. Dr. Fox is a board certified in integrative holistic medicine. She's a founding member of ICI, the International Society of Environmentally Acquired Illness. Definitely check that out. They're a great resource as well. And she is a founding physician for Ravel, an organization committed to bringing affordable care to Lyme patients. She's trained in functional medicine and has been practicing functional medicine for 22 years. She is a member of ILADS and AAEM, and she is on the medical advisory panel of Change the Air Foundation. So through her work, though, with fatigue and pain disorders, she specializes in chronic inflammatory response syndrome from mold toxicity and Lyme disease. She focuses on detoxification and treatments that remove biotoxin so that you can feel better while undergoing treatment. Now, she's launched her live mold treatment masterclass, an online treatment course for patients with mold toxicity, and she's the founder of Boulder Holistic Functional Medicine in Boulder, Colorado. How do you have time to sleep? That is amazing.
I do prioritize sleep. So not much else gets done. It's been pretty busy. Being a doctor is busy, it's just that there's a lot, and especially with mold illness, there's such a huge population that needs the information, and there's so many of us trying to get the information out to the public so people can get wow.
I know, and I love that you're not just treating patients, you're really trying to bring about change on a big scale. And I can just applaud you for that commitment because it's too many people are being misdiagnosed, not diagnosed at all, and they're suffering needlessly. So let's jump into it then, because you and I before were talking about you kind of have this mold eradication protocol, and we're gonna dig into that in today's talk, but let's kind of lay some common groundwork for those listening. When a patient first comes to you, what symptoms are they experiencing that kind of clue you into maybe mold as an underlying cause?
Yeah, so the common symptoms are fatigue, brain fog, cognitive dysfunction of all kinds, and then headaches and migraines, insomnia, anxiety. In kids, you see a lot more neuropsych stuff, some more OCD, depression, and sensory integration tics, that kind of thing. And then you see a lot of rapid weight gain and weight loss, sort of unexplainable, and acne, hair loss, frequency of urination, visual changes, and then unusual neurological presentations of all kinds that don't fit in to any neurodiagnosis. So, a lot of like muscle fasciculations, like little twitches all over the body, or numbness, tingling, weakness, burning, ice pick sensations, internal vibrations, stuff like that. And so, some of the clues are if they've got a variety of those with some weird neurologic stuff that they've been to neurologists and rheumatologists who can't figure out where it is. And especially if they went, like, I lost or gained 30 pounds in 6 weeks, then I go, okay, where did you move that year or what happened?
Yeah.
Yeah,
I mean, I think that's one of the challenges is it's not like, so many of these symptoms overlap with other conditions. And so by the time I imagine people get to you, they've probably seen a handful, a dozen doctors.
20 to 40.
Yeah. And they're not getting better, right? They're waiting
Right.
for treatment. And that's kind of a clue that maybe that diagnosis isn't correct. And I always too, one of the messages that I think people struggle with hearing is that you can have people in the same home, right? And they're going to experience different symptoms. And unlike, when strep goes through the house, everyone has this more or less the same
Right.
symptom. This affects us all so differently. So it just makes it that much harder to diagnose and which is why we have these conversations for people, because if you're still not feeling well, let's start looking for other causes, the environment and mold. So that's super important. Now, when so they come to you, they have these symptoms. I imagine when you start to diagnose them, it's probably a combination of symptoms and history, labs. Talk to us about how you go about diagnosing someone with like chronic inflammatory response syndrome,
Or
uh,
mold illness.
and mold illness. Yeah.
Yeah. So if it sounds a bit like mold, I'll go through more of a timeline about where did you live and when did you move, and was there ever any flooding or water damage or leaks or musty smells or visible mold or anything, that you would know of. And then that can kind of help me decide whether or not, it's worth it to do the testing. And so I do urinary mycotoxin testing as my, primary mode of testing. And one of the reasons is that there's different binders for different strains of mold. So if you don't know which strains you have in the body, then you don't know which binders to use to get better. As so like you can do those inflammatory biomarkers in the blood, which I don't know, like C4A, MMP9, and and to me, those can create a picture of inflammation that can be suspicious for mold, but they're not diagnostic for mold. And especially now with COVID, a lot of those same markers are up all the time. And so yeah, I do a urinary mycotoxin. I prefer the real-time labs if you can do a provocation. So the way I find the real-time labs is that it's very specific, meaning there's not a lot of false positives. We really don't see false positives very much, but it's not as sensitive, so we'll miss some cases. There's a higher false negative rate. So it really has to be provoked. And part of that is also because the people who get sick from mold are the ones who can't detox it. They can't metabolize it and get it out in the urine, the stool, and the sweat. And so if you just check a urine, that you might not catch it because if they were peeing it out, they might not be sick enough to be in my office. So I do a pretty intense provocation with an IV of phosphatidylcholine and glutathione. If they're already on a mold protocol, I keep them on the antifungal. So if you're on an antifungal and it kills any mold living in your body, it releases more mycotoxin. So it's even a more provoked test. So I don't mess around with the provocation, but if somebody can't do a good provocation, I like Vibrance mycotoxin as well. Yeah.
No, that's super helpful. I mean, I've done my fair share of urine mycotoxin testing in my family,
Yeah.
and depending on which lab you use, do you provoke, and different doctors have, different methods and things like that. But it is super important to, match that with the right lab so you're getting the accurate results. So you get that, that's one of your tests. And you kind of put together this picture and you want to start treatment. So because you have done some really great work and had some great success with like your treatment protocol. Can we kind of like get into the meat and potatoes of that, like where you start? Because I know, there's so many, you read online or there are books and it's just so overwhelming. Take us through your protocol a little bit and where
Sure.
you start, if that's okay.
Yeah, sure. So, it's my mold eradication protocol has two phases, and phase one is really designed to teach your body how to detox and metabolize these mycotoxins. So generally, um, by the time they come to me, the system has crashed. And one way to look at that is that if you're familiar with total body burden, it's almost like, we have a bucket and from when we're born, we get exposures to toxins and infectious things, and we get, plastics and phthalates and then pesticides and then, other heavy metals, environmental toxins, and you get a couple COVIDs and maybe a biotoxin from Lyme, and then you're in a moldy house and the system crashes. And so a lot of phase one is designed to take down that total body burden before trying to kill or eradicate the mold with antifungals or biofilm stuff. So the way I do it, it's pretty low and slow, a little Neil Nathan like. And so we pick, the binders based on the results. And I have people start one binder at a time and work up slowly on that binder. And if they feel worse, they go down a dose as they're working up, and then they layer in the second binder. And then at the same time, we're doing, glutathione, liposomal glutathione, and we're doing organ detox. Drainage support to open up your own detoxification channels to begin draining some of these things that are filling up the bucket and causing the system to crash. And so for somebody whose system is, quite full and it's crashed, it can take the body a little time to learn how to bind and pull out. And then, binders are constipating. So you've got to work on whatever works for that person to have daily complete movements, or the protocol will never work. And then I have like a handout, a resource guide on biotoxin relief that has all the different modalities you can add in to begin helping training your body to pull these things out. So sweating, infrared sauna, ionic foot baths, detox baths, all that stuff. And so I like to have somebody on full doses of binders, having daily movements, sweating, all their organ detox open, and all that has to be going on like once you get to full dose for at least 4 weeks is what I found before you go into phase two, which is killing any mold in that's living in the body, so antifungals and biofilm. And so one way to look at it is, so your bucket's already full, your system's already crashed. And if you start an antifungal medication in the beginning and that you do have any mold living or colonized in your system, when you start that, it'll, when it kills the mold, it'll release more mycotoxins. So you essentially just flood your system with more of the same thing that was already making you sick. And so people just get sicker. When they go in the wrong order, they go too fast, or they try to go from 0 to 100. And so it kind of has to be timed right. And I really believe if you do a mold protocol well, that you should feel better or nothing the whole time. You shouldn't really feel, I mean, maybe a day of die off here, but it's different from Lyme and other things like that. I really don't think you should be suffering. Because I believe that if you try to detox more than your body is capable of, you're just mobilizing mycotoxins around. You're not getting them out. So there's no point in suffering. And so, even when it's time, I think it's time to start antifungals. If they feel 1,000 times worse, we pull them out and we do more phase one for a little bit longer and then try again like that.
Yeah, I think too, that's the hard thing. People were so used to like, oh, take this pill for 14 days and it's like a fast fix, that this is more of a marathon, right? You are going to feel better. but it's going to take a little longer. And sometimes it's two steps forward and one step back. So
Yeah,
that the two phases, I think, makes it very digestible for people. I want to like
right.
focus in on a couple of those elements that you talked about, if that's okay.
Sure.
For those who maybe are new, talk to us a little bit about like if there are specific binders you like and how do they actually work? Because it is really interesting. You'd mentioned different binders working for different mycotoxins. Can you just explain that to somebody who's maybe newer, what that
Yeah, sure.
is?
So mycotoxins are toxins that mold release and that are pathogenic or disease causing to humans. And different strains of mycotoxins have affinity for different binder. Maybe I should say the binder has affinity for different strains of mycotoxins. And so what that's also one of the things that you can see people making themselves sick is they don't even know which binders to do, or they'll do cholestyramine 4 times in a day out of nowhere. Um, but so different binders have different affinities. So you really want to pick the ones that are best for your mycotoxin load, your unique mycotoxin load. And, some of the common ones are activated charcoal and bentonite clay, cholestyramine. Those are kind of the stronger ones. And then if somebody can't tolerate those, we do some of the more gentle ones.
Yeah. And one of the side effects, the unfortunate side effects, as you'd mentioned, this is like constipation. And it's super important that you mention that to your doctor, right? Because that is the signal you're not getting those toxins out. So what do you do if you have a patient who's taking binders and then they're like, oh, I'm kind of constipated or I'm not going to the bathroom every day? Do you pull back on the binder? Do you add something to it?
So, if they have a chronic constipation issue, I work on that before we start binders. If it's more IBS, like if it alternates diarrhea and constipation, I won't wait because a lot of times, oddly, between like the magnesium you use to soften the stools and then the binders binding everything, sometimes it regulates, something that's more IBS like. Um, but so so I have a distinction with my patients between what's a die-off symptom and what's a GI discomfort. So the dance of finding the right dose of whatever you're doing for stool softening and your dose of binders, it takes a minute to figure out exactly what you need. So the most common things I use are magnesium citrate. That's a good just healthy stool softener that you can't take too much of it. You can take as much as you need for a daily complete movement. I use one called Colonex by Zymogen that is stronger. I find one Colonex is equivalent to about 5 regular mag citrates. So if they're needing over 5 capsules, I switch them over. I really like Bowel Mover by Cellcore. I think that works really nicely. Sometimes bitters can help with motility, obviously plenty of water and as much greens and, stuff as you can do and movement, exercise helps. But yeah, those are kind of the common ones that I'll use. And if you work with it enough, you'll figure out, the right dose. Usually it's just mag citrate, but you'll figure out the right dose for your daily complete movement, which is critical for the whole protocol to work. You have to be having daily movements. But I try to tell people that's not the same as like, if you're getting constipated and then gassy and bloated, it's not the same as like if you go too fast on your binders and you go from 2 to 4 and you get systemically worse, you get a migraine and foggy and your neuro symptoms act up, like then that's die off. That's a reason to back off. And then the GI symptoms are more like binders are hard on the belly and it's a dance to figure out the right combo of things. So that one I tell them that one we work with, you don't necessarily back off. But if you haven't had a movement in 2 days, then you're going to need to stop your blinders and get things going first. Yeah.
Yeah, and it gets a little trickier with children too. If they tend to be pickier eaters and you have to get them to communicate. Teenagers, that I can't even imagine. They don't want to talk about that with mom and dad or the doctor, but it's one of
Right.
those things. So to just have on your radar. You mentioned green. So for a moment, let's talk about like diet. Do you recommend a specific kind of like mold friendly diet? Are you one of those practitioners who weighs in on that at all?
I personally believe the mycotoxins you can get from your food are a drop in the bucket next to the mycotoxins you're exposed to in a water damaged building. So generally, I have people, try to do a bit of an anti-inflammatory diet. So mold is really inflammatory. There's inflammation in your brain, it's in your heart, it's in your joints, it's all over. And so if you eat, the most inflammatory foods a lot, gluten, dairy, corn, soy, sugar, it's just going to make you feel worse. Um, and then the mold-free diet, I really don't think it's necessary in order to get well. And I haven't found that it matters all that much.
Yeah.
And
Yeah.
the anti-inflammatory diet, it's more just so you feel better. You'll still get better on the protocol, even if you don't do that.
Yeah. And sometimes those dietary changes are temporary, right? It just provides a little bit more immediate relief until you're better, and you don't have
Yeah.
to necessarily avoid dairy forever, but or whatever it is. That's really insightful. Thank you. You had also mentioned glutathione, and that is a really interesting one. I know when my family first got sick, I heard a lot about it. We had used it in our family. For somebody who is new, explain to us like what that is and why that's so important and kind of how it works in the body, if you don't mind.
Sure. So glutathione is the mother of all antioxidants, and it helps you to recirculate the other antioxidants that you get in your diet. It's critical for cognitive function and preventing cognitive decline, dementia of all kinds. And it's part of phase two detox in the liver, which you need in order to detoxify mycotoxins. So most of them have to get, a glutathione put on them to be non-toxic and get out in the urine, the stool, and the sweat. And so I usually use a liposomal glutathione. And the other thing about it is that if you've had a big mold exposure, your body will use up all your glutathione to detox and try to pull it out because your cells don't want these toxins, are toxic to them. And so they'll use up all your glutathione trying to get it out. So almost always, if I have a mold case and you check their glutathione levels, they're close to zero. Like they barely have any. And that makes them much more at risk for dementia and cognitive decline and cognitive dysfunction. And so some of it's helping us metabolize and get the mold out of the body. And then some of it is, repleting the system to, prevent um, not great things in the brain as we get older.
Now, that's another one. My understanding is you kind of want to go slow to go fast. Like you can take too much glutathione
Yeah.
initially and cause kind of a reaction. So you'll want to pace
Yeah.
yourself,
Yeah.
start at a smaller dose.
Most people do great, but there's definitely a percentage of the population that has to work up slowly or they'll feel worse. And yeah, they take their time.
Yeah, now let's talk about some of the stuff you mentioned in phase two. You talked about like the antifungals and biofilms, and I want to get into that. But there's an important distinction. You talked about colonization. And can you tell us what that is? And
Hmm.
did that happen to everyone and where does it happen in the body?
Yeah. So if you've had a big mold exposure, imagine you're living in a house that has mold and you're sleeping there every night and it's a humid day and the mold is sporulating and in the air that we're breathing. And eventually you breathe one, into your sinuses, your upper respiratory tract, or you swallow one down your esophagus and it can stick and then replicate and make babies and make homes. And, it makes like a family and communities and they aggregate together and they form what we call a colony. And then they secrete this glycoprotein matrix around the colony that protects them from our immune system and our antifungal agents. So it's kind of like the home that they live in that protects them. And so colonization is if that has occurred, if it's like theoretically living inside of you now. The most common place for colonization is the sinuses. So another part of my phase one is nasal sprays. I do an antifungal and something for biofilm nasal spray, the whole protocol. And that tries to get any colonized mold in just locally in the sinuses because they're hard to get at. There's not a lot of blood flow in our sinuses. So that's the most common place of colonization. People also get a lot of, congestion and runny nose and that sort of thing with mold. And not everybody colonizes. And the way that you can so I always assume colonization. Um, but if somebody's out of the exposure and you do phase one with binders and glutathione and nasal sprays and they get 100% better, they likely did not colonize and they don't go on to phase two.
Well, that's kind of reassuring. I know that, I've done some other interviews, and it's hard because sometimes people will either remediate effectively or maybe they move out, and some people will just get better with no intervention. Some people will, just need some minor supports, and then there's some who need even more aggressive approach. And sometimes it's that colonization at play because you're essentially taking the mold with you. You could move out to a
Exactly.
new place and you're colonized and you're like, why
That's
am I
living
feeling
inside
this?
you.
Right. And so it requires finding, healthcare practitioner who understands that, who can address that. Um, Now let's talk a little bit specifically about, antifungals. I think in the mold treatment realm, there are a lot of different camps and philosophies and things like that. Talk to us about like antifungals. Which ones are you liking? And then the role of biofilms. Biofilms, that's a really interesting topic because it's not just applied to mold, it's all sorts of things. But dig into those a little bit more for us, if you don't mind, some examples and stuff.
Yeah, sure. So, if you can imagine that there's mold living in the system, then that mold is releasing the mycotoxins into your body, just like it was when it was living in your house. And so you can bind and metabolize and glutathione and do all that stuff forever. But if you have colonized and it's living inside you, it's just going to keep releasing mycotoxins, increasing that total body burden again. You'll be, like in a boat with a hole in it and bucketing out the water. So until you actually patch the hole, which is the mold living now in your system, it's hard to get completely better, if you've colonized. So, I use the common antifungals for mold. I use itraconazole with nystatin if I use that one, and then I do voriconazole. Sometimes I'll do amphotericin B. I usually start with itraconazole, and we work our way up slowly and make sure we're not doing more than the body can get out the contents, so that we're not making ourselves more sick. And I usually have it's about the same where I would start adding in biofilm. It's about 4 weeks in on full doses of antifungals. And then so the things that open up biofilm for yeast and mold is their enzymes. And so if you take them on an empty stomach, you'll absorb them and they go and digest the biofilm. And then your antifungal can get any remaining mold in the system. So it's hard for those antifungals to get through the biofilm. And so if it is a significant colonization, you'll want to do biofilm, eventually to get rid of all of it. Now it's another place where if you do it too soon, imagine again your body's full and you open up biofilm, you just flood the system with more of the exact same thing that made you sick in the first place. So your body kind of has to be ready for it. Your total body load has to be a little lower. You've got to be binding well and detoxing well. And it's another one of those places where if you feel worse, when we add in biofilm, we pull it out and we wait and we try it again in a month or so. And we really pay attention to the person's boundary, their ability to detoxify.
Yeah, biofilms, I mean, they make it, they help it evade the body, right? It's natural
Right.
response. So it's a tricky thing. And with antibiotics and other things, it's a big factor. Do you have like any biofilm busters or I don't know if that's officially what they're called, that
Right,
you like
right.
to use with your clients?
Yeah, for mold and yeast, I think Interphase Plus by it was Claire Labs. I think they got bought out. It says like
Okay.
SFI something on it
Yes,
now,
yeah.
but yeah, it's Interphase Plus. That's my favorite one for mold and yeast biofilms. But yeah, like you were saying, every most bacteria makes biofilm. So our good bacteria and our microbiome have biofilm. And then Lyme is in biofilm, and that's a bacteria. And there's, everything kind of has biofilm. So I'm pretty a little bit more conservative than some with the biofilm stuff. Like I won't put people on long-term, nattokinase or something because I'm really concerned they're going to bust open their own microbiome's biofilm and make it less strong too. But it is something that you have to do at a, some point in the protocol.
Yeah.
And a lot of people, because they're enzymes that you do in an empty stomach, they're blood thinning. And so mold makes your blood more thick, viscous, sticky, a little hypercoagulable. That's part of like why we feel sort of sluggish when we have mold. And so sometimes you add in the biofilm and the blood thinning effect is amazing. And
Mhm.
people just feel a lot better and they can think and their energy comes up. So, it's not always necessarily bad. A lot of times it feels great.
So how long are you seeing people like, and I know it'll vary greatly, but how long is like a typical course of treatment? Is this a
Oh,
couple months? Is it a year? Is it longer? What are you seeing?
well, I like to preface this. I hate this question.
I know, I know.
I like to preface it with if we're doing it right and you're no longer being exposed, you start feeling better pretty quickly. So a lot of people, if they're no longer being exposed, you put them on the right binders, and 2 weeks later they'll have a shift. They'll feel somewhat better. And then each different week and each different phase, you're going to feel better and better and better. So it's when I say how long it's going to take, it doesn't mean that you're going to feel like you do now until then. Like you're going to be feeling better the whole way, but to get it completely out takes some time. So, I mean, I would say probably the shortest, which would probably be like somebody young without that much total body burden and no longer exposed when they came to me. Probably the quickest would be 3 months and probably average of almost a year.
Yeah. So I'm curious because I want to circle back to something you said. You had mentioned if you're no longer being exposed. So I want to do a quick like plug for people if you're listening. It is so important. Scott Forsgren has a great quote about how we can't expect to be healthier internally than our external environment. If you are wanting resources on how to inspect, investigate your home, how to remediate your home, if you're going to move, maybe you're in a rental situation, please head on over to our website, changetheyearfoundation.org. Go to our resource tab. There's so much there. There's a start here tab that takes you step by step through, lots of free downloads, lots of free resources, because that is an important step. If you're constantly being exposed and you're doing treatment, Dr. Fox, I don't know if you agree, the treatment is not going to be nearly as effective if you're, still living in a moldy environment. So check that
Yeah.
out.
So yes, so you're not going to get completely better if you're still in the mold.
Yeah.
Sometimes you'll get somewhat better. It's like it's still good to start because that binding, those levels will just keep going up. So as you start taking your total body burden down, but you won't get all the way better. And I use the Change the Air resources for remediation for all my
Okay.
patients.
Oh, great.
Because
Thank you.
half of like I'm not a remediator. I'm not on the home side. I know how to heal your body, not your house. So I mean, I kind of know how, but I can't. I'm not out at your house making sure they're doing it right and all that. So a lot of what I have to do is teach them how to find the right people. I mean, if they're here in Colorado, I can send them to the right people. But if they're not, what you're looking for, what a good remediation is, and how to test after to make sure it was done well, and whether or not you need a small particulate cleanup and
Yeah.
all of that. So yeah, those are amazing resources.
Yeah, and I'll even drop those in the show notes for people listening. We have one specifically, it's questions to ask when hiring an indoor environmental professional. That's the person who does the inspection, and then questions to ask when hiring a remediator. And then, of course, if you sign up for our newsletter, changetheyearfoundation.org, you get I think it's the best. I think it's one of the only consumer-friendly explanations of what remediation actually looks like. It's step by step. It's got pictures. It's written by me for you in layman's terms. So we know how overwhelming it can be. But yeah, so that's helpful. And I'm glad you said that that you can start some things in place while you're either working on getting remediated or moving out. Now I'm curious, and you kind of talked about one. What are some common treatment mistakes though you see people making? You had said, going too fast with the binders, but can you summarize a few mistakes that you see?
Yeah. So some of it we've talked about, but going too fast. So from 0 to 100, if you just start on 4 activated charcoals and you were on none, you might feel sick, you might mobilize more than the body can get out. And one way I like to explain it with the detox, at least with phase 1, because phase 2 is a little easier to understand. But the way that I look at it is in phase 1, like so you're binding and you're pulling out these toxins in your GI tract and you're trying to metabolize them with the glutathione and you're opening up your drainage channels. And as this begins to work well, and a few weeks have gone by, the rest of the cells in your body get the signal that there's a way out for these toxins. And they're toxic to the cells. They don't want them. So they'll start dumping. And if they dump more toxins than you can get out in the urine, the stool, and the sweat, that's when you feel worse. And so that'll kind of explain a lot of the things that people can do, that make themselves more sick. So going too fast on binders, starting antifungals or biofilm too early in the process before your body's ready for it, doing the wrong binders, not knowing which, binders you're supposed to be doing, staying in a moldy house and think you're going to get better, thinking an air filter is going to take care of it for you. And, one of the saddest ones is when you get a poor remediation.
Yeah.
Yeah, that's a horrible one because people spend so much money and time. But yeah, it's a lot of going too fast and in the wrong order and
Yeah.
not listening to your body and thinking if you suffer that you're gonna just get there quicker.
Yeah.
I
Like,
can't tell how often I just have to say, I swear to you, it will not go faster.
yeah,
I know
they'll
you want
just
it to
push
be
through.
done.
Yeah. No, it
Yeah,
doesn't
it
work that
doesn't
way.
work that way with mold. It just doesn't.
So how often, and you don't need to go on a tangent here, but you also treat patients with Lyme. We see a lot of
Mhm.
mold and Lyme going together, my case in particular as well. Do you dress mold before Lyme? Do you dress them in co-infections? Do you dress them together? Like, what are your thoughts on that? How do you approach?
Yeah. Great question. So from my perspective, and I think everyone in the mold community, but most of the Lyme community as well, is that if you have mold, you just won't clear Lyme. Mold is a complete attack on the immune system, and in the presence of mold, Lyme can become opportunistic and reactivate and start replicating and wreak havoc. A lot of your symptoms can be more Lyme than mold. But if you treat the mold and your immune system comes back online, a lot of times the Lyme goes back into dormancy, not to replicate and come back, again. So I always treat the mold first. I always feel like if you start Lyme treatment before you've gotten rid of the mold, they're just going to be on Lyme treatment longer. And in Lyme treatment, there is herxing, there is feeling worse. And so, why put somebody through that when they're not going to get that far on, Lyme treatment if there's mold in the system. So I always treat mold first. And every single Lyme patient I have, I make them do a mold test, whether, it sounds suspicious or not, just because it is just such a deal breaker. If they've got mold, they can go down that Lyme treatment road for 2 years and not get better, and they'll kick themselves if they didn't know. So that's in my very first thing I do in Lyme.
Yeah, and I think what's so hard is people, and I'm sure you've seen this, like, oh, I don't have mold, I don't see it or smell it, and the
Right. I don't have mold.
that, right, is it's often hidden, or they'll say, well, I addressed it already, but it
It's,
wasn't remediated correctly. It's still a sore. Maybe they painted over it or they ripped it
yeah.
out and there was no containment. And so
Yeah.
it is worth taking time to ask like some of those questions because
Yeah. And a qPCR is pretty easy. Like if they think they remediated and they did it well, then you should have a clean qPCR
yeah.
afterwards. Yeah.
Yeah, that's that dust testing. Lots of different
Yeah,
companies
that
sell
does
it now.
test. Yeah.
And ruling it out because I think too, like, so some of the studies say that it's 1 in 2 homes. We know the number is likely higher for homes that are impacted by mold and water damage. And so I love that, when we first started the interview, you said one of the first things you do is you ask your client, like, how different, I wonder, things would be if more doctors and healthcare practitioners ask that question. Tell me about the place that you're living in, because the connection that mold has to like anxiety and depression, Alzheimer's, all of those things that you said. I know when I took my children to the pediatrician, when they're young, they have the question, do you live in a house built before 1978? And you have to do all
With
that.
the lab and
Right.
yeah.
Wouldn't it be great if, like, asking about the history of water damage or leaks or flooding or burst pipes? I think it would change a lot of things.
I do
We hope
too.
to
They
get there.
probably would not know what to do with the answer. So
That is hard too, but that's why we, hopefully we're having these conversations. People will keep sharing resources and things like that, and will help people connect. Now, I know we're running low on time. If you kind of had to summarize a couple key takeaways for people when it comes to mold and treatment, like what would you say?
Yeah, I would really just say take your time with it and make sure that whatever doses you're doing of binders and things, that it's not making you feel worse. You should feel better or nothing at every step of an increase or progressing into a protocol. And like we said before, you shouldn't suffer through it. And one of the other things I would just like to say is it's a really treatable diagnosis. People get better, they get all the way better. It doesn't take forever. They don't feel worse. It's totally doable. It can feel really insurmountable when you're in the mold and you're really sick and you're anxious and not yourself. And but there's always a way out. And then when you start treatment, people they do really great. It's not a bad diagnosis at all.
Yeah, and that hope is like super important because I've been there, and I think one of the challenges of this illness is like you have to heal your body and your home, and it's expensive, and finding the right people and all of that is so hard. That's why we connect with you and ICI and all those great resources so that people can get to the right diagnoses and to the people who can help them. So that kind of leads us to our last question. If people had questions, because you treat everything from Lyme to mold, hormonal issues, and stuff like that, how could they find you? You have a bunch of resources. Tell us about that.
Oh, I mean, probably 80 to 90% of my practice is now biotoxin, mold or Lyme. But now it just walks in my door. They go, I have mold, help me.
Yeah.
I have Lyme, help.
That means
Um,
the awareness is working, right? People are
right.
picking on
Yeah.
that.
It just,
Good.
it used to be like, ooh, I would figure it out. Now it's like that just walks in my door. So our clinic is in Boulder, Colorado. It's boulderholistic.com. And there's tons of resources on there as well around mold and just functional medicine. And then my other website is drfoxmedicaldetective.com, which is the website for my master class. And then we have a couple Insta and Facebooks that should I just give you those later?
Yeah, and we're gonna link to all this in the show notes so people can find it and you can they can follow along and stuff because your resources are great. I've poked around a bunch of them.
Fun.
We'll make sure that people have access to all of that. Thank you so much for being here. And I'm so excited that, now that you're on our panel, that we're going to have some more interviews and things like that. So people will hear from you more, which is great. If people had follow-up questions too, for maybe a follow-up interview, you can send those to me at kendra@changetheairfoundation.org, and we'll make sure to ask Dr. Fox next time she comes on. But thank you for being here.
Oh, thank you so much for having me. And thank you for all the beautiful work you guys are doing in the world.
Oh, well, you're welcome. And for everyone listening, thank you so much. Do me a favor though, if you found this information helpful, like, follow, and share us on Facebook and Instagram and all of those things. And if you want to make sure that you never miss a great interview like this, head on over to changetheairfoundation.org. Sign up for our newsletter because that really is the best way to get great information like this directly to your inbox. We'll see you guys next time. Thanks so much.